Hello, my name is Erica Starling, and Jessica Brady and I created a PowerPoint for NU 712 Clinical Prevention and Population Health. It is entitled Put It Out, Smoking Cessation in Adults. The objectives for this PowerPoint are noted as: what is smoking, what are the demographics being assessed, what are prevention plans and which one will be discussed, and what are the risk factors and diseases that are caused by smoking, and what is a smoking cessation plan, and how is it used to help quit smoking. What is smoking? The definition of smoking is the inhalation of smoke of burned tobacco. It may occur at occasional times or habitually. Smoking is a consequence of a physical addiction to nicotine and other chemicals that are in tobacco. In this PowerPoint, the demographics discussed are at least 18 years of age and older. Both male and female adults of all races and ethnicities are considered together as one population. Understanding how diseases are developed are vital in order to plan and implement a framework for disease prevention and control. There are three types of prevention plans. The first one is primary prevention, which is used to reduce exposure and susceptibility to diseases. The next prevention plan is secondary prevention, which is when the disease are being detected and prompt treatment is being issued. The last one is tertiary prevention, which is implemented when the disease is prevalent. The goal is to alleviate disability and restore function as much as possible. Primary prevention will be implemented in this discussion. The goals of primary prevention are to alter susceptibility of obtaining a disease, reduce disease exposure, promote healthy lifestyles, and prevent diseases. There are many symptoms of smoking. These symptoms can range from physical appearances to bodily harm. They include bad breath and yellowing of the teeth and hands, increase in lung infections, heart rate, and blood pressure. It can cause difficulty breathing, coughing up phlegm, decreased oxygen levels. It can cause premature wrinkling of the skin. Also, it can lead to hair and clothes smelling like smoke. Symptoms of smoking may be avoided by quitting smoking altogether, which could improve a person's lifestyle. The Center for Disease Control and Prevention notes that smoking is the leading cause of disease and disability. It also harms almost every organ in the body. They also note that it is the leading cause of preventable death. One article study notes that tobacco smoking is the leading cause of cancer, yet it is the most preventable cause of cancer in the entire world. Healthy People 2020 note a multitude of risk factors and diseases. One of the first listed is cancers and which cancer smoking can cause. The Healthy People 2020 note that other diseases may be caused by cigarette smoking. These include heart disease, stroke, lung diseases such as emphysema, chronic obstructive pulmonary disease or COPD, pneumonia, and bronchitis. Other diseases include diabetes, blindness, and cigarette smoking may increase the risk of arthritis. Smoking cigarettes may cause problems with reproduction. In females, it can cause ectopic pregnancies, premature birth, lower birth weights, and stillbirths. It may reduce fertility in women and cause birth defects, including cleft lip and/or cleft palate. In males, smoking may cause erectile dysfunction. The harmful effects of tobacco do not end with the user. There is no risk-free level of exposure to secondhand smoke. Since 1964, 2.5 million deaths have occurred among non-smokers who died from diseases caused by secondhand smoke exposure. Secondhand smoke may cause heart disease, stroke, and lung diseases in adult non-smokers. Children and infants who are around secondhand smoke may have an increased risk of severe asthma, respiratory infections, ear infections, and sudden infant death syndrome. The Centers for Disease Control and Prevention website states that 155% of all adults, which is about 37.8 million people, are current smokers. One article notes that current smokers who are obese have an increased risk of death compared to non-smokers. Another article notes that 100 million deaths were caused by tobacco use in the 20th century. While it is estimated that 1 billion deaths will occur from tobacco use in the 21st century, one article notes that asthmatics who quit smoking improved asthma biomarkers. The article also noted that after 6 weeks, the cessation group noted improvements in asthma control and lung function. A different article notes that in the United States, cigarettes kill about 480,000 people per year. It also notes that smoking is estimated to contribute to 30% of all cancer deaths each year. What is smoking cessation? The NIH National Care Institute website defines smoking cessation as the act to quit smoking. It lowers the risk of cancer and other serious health problems. The Center for Disease Control and Prevention notes that the side effects of smoking cessation are related to the withdrawal of nicotine. These side effects are irritability, anger, anxiety, having trouble thinking, craving tobacco, feeling hungrier, which leads to weight gain. One article from the Joanna Briggs Institute notes that each patient who wants to quit smoking needs to be assessed. Assessing the patient consists of assessing the intent in quitting smoking, setting a quit date, learning more about cessation programs, current tobacco use, medication history, and smoking triggers and strategies that need to be overcome. There are ways to increase smoking and cessation. These ways are implemented by others to help smokers quit. These ways include raising taxes on tobacco products, expanding smoke-free areas, banning advertisement in certain areas, using plain packaging, and running mass media campaigns against smoking. There are 2 interventions a person can take to quit smoking. There's the psychosocial intervention, which refers to the physiological or social support mechanisms. The other is the pharmacological intervention, which includes medications and prescriptions that help reduce smoking. These 2 interventions can be used separately, but the smoker would have a better chance of quitting if the interventions were combined. The psychosocial interventional aspect includes the mental preparedness of the individual who is quitting smoking. These include counseling, telephone counseling, support groups, self-help books, and behavior therapy. The psychological aspect of smoking cessation is important and tailored to each individual who is quitting smoking. The pharmacological intervention includes nicotine replacement therapy such as nicotine patches, gums, and lozenges. It also includes nicotine receptor partial agonist, varenicline and cysteine, antidepressants, bupropion, and nortriptyline. One article notes that fluoxetine, nicotine replacement therapy, bupropion, and varenicline may lead to a significant reduction in weight gain. An example: a 45-year-old female presents to a clinic. She states that she is ready to stop smoking. She states that she has been smoking since she was 15 years old. All of her previous attempts at smoking cessation has failed. The patient states that she has been smoking for 30 years. She has tried various methods to quit smoking and has failed every attempt. She has expressed a serious desire to quit smoking. She stated that her ideal quit date that she wants to obtain is in with the next 6 months. The patient will continue smoking cessation through pharmacological methods. A prescription will be given to the patient based on her medication history and mental history. The medication will be taken as a prescription on a regular basis. The patient will not skip doses. The patient will begin her psychological aspects of a program. She will enter a support group that will help her find other smokers who are quitting or have already quit smoking. She will use counseling through person or by telephone to help with any cravings or questions she may have. She will utilize any self-help books or programs to aid in her smoking cessation attempt. The results of the patient 6 months later are complete. The patient is smoke-free currently and has been for some time. The patient still has cravings for tobacco, but not nearly as much as when she first stopped smoking. The patient has decided to continue her support group and counseling sessions to help her continue to be smoke-free. The patient has agreed to wean off the medications that she has been prescribed for smoking cessation. When attempting cigarette smoking cessation, an individual will most understand the risk factors and diseases associated with smoking. The side effects of quitting smoking must be learned so the individual will be prepared to recognize the side effects. Primary intervention is applied when they attempt at smoking cessation. The individual must verbalize their readiness to quit smoking. An assessment would then be used to determine this readiness. Psychosocial and pharmacological interventions would be applied in helping the individual to quit smoking. Once all these are implemented, the patient will obtain results. Yet it is ultimately up to the individual to stop smoking. Thank you.